Hello, my name's Therese Morrissey, and I'm an advanced care planning social worker with the Health Plan. And I'm really happy that you've joined me today to learn more about the importance of advanced care planning. What is advanced care planning? It's a process of communication and planning for future healthcare needs. It's not a one-time event. It's a conversation that goes through the years. And it has three components. So the first component of advanced care planning is about reflection, thinking about your wishes and your values. Secondly, it's discussing your wishes with your close loved ones and your physician. And thirdly, it's documenting your wishes in a legal document called an advance directive or a healthcare directive. Most importantly, it's important to act now. This is important for anybody over the age of 18, any adults. We shouldn't be waiting until we're sick or elderly to be starting this process. So why is it important? Firstly, it allows you to be a part of the treatment decision process. It allows you, with some pre-planning, to be able to say what you would want if you ever couldn't speak for yourself, so that somebody who you trust could step in and just be your voice. Secondly, it lessens family tension and disagreements. If all of your close loved ones have heard from you what you would want if you were nearing the end of life or incapacitated, it lessens the chance of them disagreeing about what you would want. Thirdly, it lessens family guilt and burden. I used to work in an intensive care unit in a hospital, and my role was to facilitate family meetings with the physician, and the patient would be on full life support, so the breathing machine, the tube feeding, all of that, for weeks. And it wasn't working. He wasn't getting better, or the patient wasn't getting better. So the goal of this meeting was to ask the family, what would your loved one want? Would they want to move to a facility and live this way? Or would they want us to stop these life-prolonging treatments and let them die a natural death? So the difference, most of the families I worked with had never had these conversations, and the amount of guilt and burden was tremendous. These are decisions that people have to live with. The families who had these conversations, they didn't have that guilt and burden at all. They just voiced what the person would say if they were in the room. And they were very appreciative that their family member had told them what they wanted. And then lastly, this could save your family time, energy, and extra cost. So some states are what's called a next of kin state, and others are not. So if you're not a next of kin state, it means that your family members can't just automatically step in and make all decisions for you. It could be that you'd have to involve the court system and pursue guardianship, which is very stressful and expensive. So how do you start thinking about this? How do I know what my values and my wishes are? Where do I begin? So start thinking about you as a whole person. So we're multidimensional people. We've got physical dimensions, we have emotional dimensions, spiritual, cultural. So thinking about asking yourself questions like, what gives my life meaning? What brings me joy? What causes me worry? What am I afraid of? And then kind of go through these realms. Physically, what's important to you? Is it building? Is it baking and cooking for your family? Is it running marathons? And if you have a health condition, or possibly a progressive condition, looking ahead at what complications could possibly arise, and what limitations could be imposed on you, and what limitations are you comfortable with? What's acceptable to you and what's not acceptable to you? And emotionally, your relationships, what's important to you? How do you cope through difficult times? Who do you lean on? What do you lean on to cope emotionally? And then spiritually, where do you fill your cup spiritually? Is it a walk in the woods? Is it going to a church service? And then culturally, we all have rites, rituals, and traditions within our families, within our workplaces. What is most important to you, especially if you were nearing the end of life? What traditions are really important to you and mean the most to you? And then we do have a tool on our website, and it's called an Advanced Care Planning Personal Worksheet. And I really encourage you to look at this form. It's got lots of questions on it, similar to these questions, like who and what matter most to me? What treatments would I want or not want? And do I want to be an organ donor? If that's something that's important to you, whether you do or don't, let your family know that. The personal worksheet is a great tool for you to just kind of sit with yourself for reflection, and then it's also really useful to share with your close loved ones so that they know what your values and wishes are. So we're going to talk about a few interventions that you could be in the position of having to make a decision about. Either you are the healthcare agent for somebody else, or these are decisions that your healthcare agent may be having to make on your behalf. We'll start with a feeding tube. So Bob recently had a massive stroke. He's not able to communicate and cannot swallow. He had previously told his family that he would not want his life prolonged by feeding tubes. So therefore, his family chose not to have a feeding tube placed, and he was allowed to die a natural death with his family by his side while the medical team kept him very comfortable. Next is intubation or a breathing machine. This one has come more to light with COVID recently. Michael had a heart attack and was found unresponsive by his wife. She called 911 and he was put on a breathing machine at the hospital. He had told his family that he did not want to be on life support if the chances of recovery were unlikely. After consulting with the physicians, his wife and his family chose to withdraw the breathing machine, and again he was kept comfortable and his family was able to be at his bedside for the end of his life. Resuscitation and CPR, also that stands for cardiopulmonary resuscitation. So we'll use the example of Teresa. She has severe lung disease, and during her Medicare annual wellness exam, she discussed the risks and benefits of CPR with her physician. So based on that discussion, Teresa decided that she would not want CPR if her heart stopped. She felt like the risks outweighed the benefits. I worked with a patient once who had severe heart disease and relatively young woman, but her heart disease, there was no surgical intervention. And she went to her cardiologist after we talked about do not resuscitate, and I encouraged her to talk to her cardiologist about what are the risks and benefits. And her cardiologist told her that if her heart stopped, the chances of her recovering to the level where she could meaningfully interact with people and live her life the way that was acceptable to her was about 10%. So she, with that new knowledge, she decided to become a do not resuscitate, and her doctor helped her. So if this is something that you are curious about or want more information about in your circumstances, I would encourage you to start with talking about it with your physician and asking those questions. So palliative care is a service that is available to us in the inpatient and outpatient setting. So it's a team approach. It includes a doctor, a nurse, a social worker, and a chaplain, and a nurse practitioner. And they are, if we could think back to the other slide of exploring the whole person, palliative care is interested in quality of life. They're an extra layer of support that's available to you to manage symptoms and look at your whole quality of life and make sure that you are able to enjoy your life as much as you can with your life-limiting condition or chronic condition. So we'll talk about Jim. He has prostate cancer with bone involvement and experiences nausea and pain during chemotherapy. His oncologist placed a palliative care referral to help manage his pain and nausea while he was receiving treatment. So palliative care is a service that you can receive while you're receiving treatments. They just join with your other specialists and your primary doctor. They just join the team. Another service available to people with a life-limiting condition or terminal diagnosis is hospice. So again, similar to palliative care, it is a team approach. It's a medical director, a nurse practitioner, chaplain, social worker, a grief counselor, and a certified nursing assistant to help with things like bathing and personal cares. They can go to your home or wherever you consider your home. If that's a facility, they can come to you. In some cases, there are inpatient residential hospices as well. So we'll talk about Susanna. She has end-stage heart disease. Her goals are to remain at home with her family and attend her daughter's wedding. Hospice provides the needed medical equipment like a bed, hospital bed, and symptom management. She's able to attend her daughter's wedding, and she's able to die at home with her family, which was her goal. So kind of differentiating palliative care and hospice, because those are sometimes confused. Hospice is more end of life. So while palliative care you can have while you're also going through treatment, hospice is more for you're not seeking curative treatment anymore. Your goals are to be comfortable for as much time as you have. Typically, the criteria for hospice is either 6 months or less, or if the doctor were to say, I wouldn't be surprised if this person died in the next 6 months. That's generally speaking the criteria. We know people live longer, shorter, but that is the general criteria for hospice. So I want to read a letter to you. This was shared by a member to us, and she wanted others to know about her experience, about how preparing with advanced directives impacted her husband's end of life. So, in no more than 10 minutes after I had spoken with him, my husband had a brain bleed in our home, paralyzing him on the right side and taking away his ability to speak. After a day in the emergency room and 1 week at hospice, he passed away. A couple of our earlier decisions, based on the advanced directives he and I had filed with our physician in 2005, were activated on his admission to the emergency room. The physician on call noted his do not resuscitate bracelet and did not put him on a ventilator. The neurosurgeon there to speak with me described a surgical intervention which could be made but would not restore him to his former self, not eliminate the paralysis, but would have left him requiring a level of care beyond what I could provide at home, even with assistance. This would have meant a nursing home, his greatest fear. Based on our discussions and actions during our 61 years of marriage, it was not difficult to act on decisions affecting him. We each knew what each other's wishes were based on having prepared advanced directives. And next we'll speak about how do we choose healthcare agents. And this means who would you want speaking for you if you were not able to speak for yourself? So a healthcare agent has other terms that it's called. Sometimes it's called a healthcare agent, healthcare proxy, POA for healthcare, agent, or spokesperson. So those words are all used interchangeably. That can be confusing. But they all mean the same thing. It all is referring to the person or persons that you would choose to speak for you. This person can be anybody over age 18. They don't have to be family. They can be a family member. They can be a close friend. They can be somebody in your, church community, but anybody over age 18. So the things to think about when you're choosing a healthcare agent are, 1, somebody you trust. That is critical. Somebody you trust and who knows you well. Ideally, somebody who knows your healthcare. Somebody who you think would advocate on your behalf. Somebody who would really ask those hard questions and demand the care that you want and say no to the care you wouldn't want. And who would honor your wishes even if they didn't agree with them. And then somebody who's available by telephone. We often get the question, can I choose my son who lives in California? And you can, as long as your son is going to be making himself available by telephone. They don't have to live locally. And also important to know with choosing a healthcare agent, there are many people who ask, what if I don't have anybody who I can choose? There's nobody that I really trust enough. Maybe you've outlived family and friends. In these cases, you can fill out a medical healthcare directive, and then your medical team, you can have it on file at your doctor's office, and they would know what your medical wishes are. Or I encourage you to think of, outside of family members, friends, people in your church, people in a club that you belong to. And, if you can't think of somebody now, maybe there's somebody who you really admire and respect and you want to build a relationship with, and you really trust them, and, you can talk to them about, I'm thinking about a healthcare power of attorney, and is this something that you would ever be interested in considering and kind of fostering that relationship? So there are kind of creative ways to kind of think about this. The conversation, the advanced care planning conversation. So what do I want my healthcare agents to know about my treatment preferences and my values and beliefs and the quality of life? And how do I start and continue this conversation with my healthcare agents and loved ones? One way that I find very useful in talking about these conversations is to use personal experience. So if you have a family member or a loved one who you've lost, you've kind of witnessed their end of life experience, you can talk about that. You can say, do you remember, to your kids, you could say, do you remember when Grandma was in the intensive care unit and she was on all those machines? And, do you remember when she had talked to us and told us that she didn't want that? Do you remember? And kind of use those examples to think about if that were happening to me, or even, maybe sounds corny, but a TV show. I would want that or I would not want that. Just kind of bringing it up casually. And then also you can bring up this presentation and the information that's on our website about what advanced care planning is, and really normalize it, because this is something that we should all be talking about. And then what if my family doesn't want to talk about it? This is an uncomfortable subject. There are lots of people who really have a difficult time talking about it. So you can write your wishes down. You can write them in a healthcare directive again and have that on file. You can write it down informally and just have it someplace where your family, and tell them where it is and say, whenever you're ready, I would like to talk about this with you. And I also have it written down for you and tell them where it is. And then it's also important to talk to your healthcare provider. So your primary care physician, or maybe you have a specialist. In the case I talked about earlier, she had a really close relationship with her cardiologist, and that was kind of her her biggest medical condition. So that made sense for her to talk to her cardiologist. So whoever it makes sense for you, who do you have the most trusting relationship with? And based on your medical conditions, what makes sense to you? And then prepare for the visit. As we all know, our doctor visits are very quick, and there's a lot to talk about, and so it's important to prioritize this. Our doctors aren't always going to ask us these questions, so it's important for us to bring this subject up. They'll be grateful that you have brought it up. So in summary, six steps in this process. So number one, you want to consider who you want as your healthcare agent or your proxy. Who do you trust to make decisions for you if you can't make decisions? 2, you want to share your end-of-life wishes with that person and also with other family. If you have, I think of this a lot with parents, and they have maybe a spouse and a child as their agents, but then they have multiple other children. It's important to talk with all of them about what your wishes are so they all hear it from you. And then also clergy, if that's important to you, and your physician. Thirdly, you're ready to sit down and complete your advanced directive or your healthcare directive. And once you've got it completed, you want to provide copies to your healthcare agents and to your doctor's office so they can get it into your electronic health record for you. And then you want to keep the original at home in a safe place so it doesn't get lost. And then next, you want to review your advanced directives at least every decade or earlier. And then they call these the 5 Ds. So every decade, with any health decline, with any new diagnosis, a death, or a divorce, or any family discord, you want to review it and make sure that it's still up to date. And if it's not, you want to get it updated. And when you do a new one, it makes the old one null and void. And then remember that advanced care planning is a process. So it isn't, I talked to one person who said, oh, I did that. I think it was 30 years ago when my kids were little, and he hadn't looked at it since. So good idea to just go through it every decade or so and just make sure that it's still reflecting your wishes. And in the healthcare website, you will find tools like I mentioned before. You'll find the Advanced Care Planning personal worksheet. We have a glossary of terms for you and a sheet with myths and facts. And then we also have the documents in your state that you can just download right from our website. So I encourage you to go to that website, and then if you have questions after watching this, or you sit down to complete your documents and you have questions about it, I encourage you to reach out. You can fill out the Enroll Now form on the website, and then one of us, a social worker, will get in touch with you to answer your questions and assist you. Thank you so much for watching today. I really appreciate it.